We'll call to order the meeting of the Incarceration Prevention Reduction Task Force, the Behavioral Health Committee. Thanks to everybody for the flexibility in being able to move to today's time. It was hard with Dan trying to be in 2 to 3 places at once, so we really appreciate that and appreciate this group's continued attendance. I think we have some really good membership in this group, and I just want to thank everybody for their attentiveness. Unless there's something to bring up for the good of the order before we go ahead and start, now that we've called to order, I'll go ahead into number 2 on our agenda, which is bringing on children's initiatives. And Heather, if you're ready for your presentation, we would love to see it.
I have a short slideshow to share. Is it possible to make me a co-host for a moment?
Yeah, I'll go ahead and do that. Just give me one moment.
Thank you, Jill.
All right, there you go.
Okay, let me navigate to share screen. Okay, and so thank you so much for the opportunity to share some of what I see and know about the work around children in this community. And I just want to say that this is not exhaustive at all, but it's just a brief overview of some of the different groups. And why it's important is that as we in the Incarceration Task Force talk a lot more about prevention, because we know we see a big return if we can prevent someone from ever even ending up in incarceration. I think there's just a need to be aware of what the other efforts are underway across the community. So there are a few key documents that I think really support the data and these different work groups' efforts that I wanted to highlight. One is called Whatcom Working Toward Well-Being, and that's a plan that the Whatcom County Council has approved. And we can send a link out to these documents, but they're within that plan, youth behavioral health in particular has been highlighted as a priority. And that came from months and months and months of listening to families talk about what's important to them. And there's a number of other things in that plan, and it's really geared toward what can Whatcom County as a government do to help support families and children. And then we also look at the community health assessments a lot. Healthy Whatcom is a group of the health department that convenes a number of community health leaders and institutions, and that document drills down into disparities within the community. And when we look at behavioral health and mental health, we see a lot of racial disparities. We see disparities based on sexual orientation. We see some disparities based on income. So again, these are just important documents for us to consider as we strategize and think about different kinds of programs and interventions we might want to support. And there are others, but those are 2 really key ones. And then there are a number of groups who have identified behavioral health and prevention as priority areas as well. Healthy Whatcom is one of those. Generations Forward, which is a group convened by the Opportunity Council and the Health Department. And there's a family council group within that coalition. It's a huge coalition that really informs the different priorities, which I'll go into a little bit, a few slides down. And then right now, there's a lot of energy in this group that has a really terrible name, but the Policy Funding and Advocacy Group. This group has been really advocating around this year's budget, Whatcom County's government budget, to advance the goals of Whatcom Working Toward Well-Being, and there was a proposal at one point to develop an Office of Child and Family Well-Being that would be looking at these disparities and doing things like supporting better behavioral health supports in the community. And it's community work, so it's complex and lots of different players and a pretty vast landscape, but lots of energy there. And then I just would be remiss in not mentioning that United Way is undergoing, they received a really, they received a significant grant from the Department of Commerce to map childcare needs in the community. And although that's not directly tied to youth behavioral health, it is a very important economic driver for our community. And then Check-A-Net Health Foundation, of which I'm the executive director, is conducting a fiscal map for childcare specifically. And why that's important is that fiscal maps are a really key piece of data that communities need to understand, so we can better leverage revenue streams and figure out ways to create new revenue streams if we need to support things like behavioral health systems. The two key goals that are being advanced right now with Whatcom Working Toward Wellbeing are support for an information and navigation system, because we've heard from families that the systems are hard to navigate. And so we have a great example with the C's line, where there's one phone number a family can call, and they get connected to resources. So somebody's helping them navigate all the different resources, versus that family having to call 12 different providers and try to understand what their insurance covers. And WAHA used to do this for healthcare specifically, the Whatcom Alliance for Health Advancement, and it's just a big need. So that has been prioritized this year, and a task force for children and families has also been prioritized this year within the county government. That came in front of the health board today and did not pass today. They put it on hold to do a little more work around who's represented at that table, because there's a strong desire to hear directly from families and people who are impacted by the systems. So the policy funding and advocacy group, I'm not going to go over this slide, but it was created to look at different policy opportunities and to look at funding sources. And they were a big supporter of the Whatcom Working Toward Wellbeing Child and Family Action Plan that Whatcom County passed. And I just think that this is so key. I love this quote, that programmatic interventions help people beat the odds, but systemic interventions change the odds. And this illustrates that when we go up to the top of the pyramid, we're increasing individual effort needed for things like interventions, counseling, and education. And then at the bottom, though, if we're really looking at what we consider social determinants of health and socioeconomic factors, we can increase the impact across the population and sometimes see a different and higher return. And then there's that piece in the middle too of changing the context to make individuals' default decisions healthy. So there's a little bit here about policy windows of opportunity. I wanted to actually just show you this, the Generations Forward priorities. You'll see on there that expanding availability of mental health and behavioral health supports for pregnant and parenting people and young children has emerged as an important priority from Generations Forward, and it's a priority among a number of groups. So that's the end of my slideshow, and that's just a little background for you on some of the different pieces that are being worked on. I'm going to stop sharing so I can see everybody, but what I want to say is that there is energy and vision around the idea of a children's initiative that could further support all sorts of things that we know help families and children be healthier. And part of that is a behavioral health and mental health. And so I look forward to bringing more information back to this group as that emerges, and we'll definitely need everyone on board if we move forward with that kind of idea. Dan, you've been involved in some of this work too, and I welcome, and also Byron, of course, you're key in this in the nonprofit community, and Mike, and Anne is essential too. And so if there's other things you'd add that you know of, I welcome that, or questions.
Dan, you have a hand up?
Yeah. Hey, Heather, thanks for the presentation. That was really, really helpful to kind of get everyone back on the same page. I had just a question around the Office of Family and Well-being, just how that's going to, like, what do you anticipate in terms of the, times of COVID and budget shortfalls do you predict that that's something that's going to happen at the county level within the next, say, 2 to 3 years?
I think that my prediction, I don't make predictions about what's going to happen in government anymore, but I will tell you that it will not happen this year with this budget. I think that we were fortunate to even have a task force and support for that task force included this year. But I have heard remarks like, let's do the task force first to really understand if we need an Office of Children and Family Wellbeing, and have that be a recommendation from the task force before moving forward.
Not seeing any other hands. Do let me know if there are any other questions. Heather, I had one. So yeah, I served on a couple of those, and I was curious if there were particular programs or interventions. You know, on this committee, we get to hear from Byron sometimes about some specific interventions, or boy, we're really seeing a need for this particular thing. And of course, in our committee, we're really keenly interested in those interventions which have payoff down the road in terms of helping people avert criminal justice systems. I'm wondering, I didn't see, I know you're giving us an overview, but just from your experience in the work, are there a couple of things that come to your mind that would be really, really instrumental? I know there's a whole basket, a big basket of work, but I'm wondering if there's something that rises to the top for you.
So actually what rises to the top for me in response to that is that there are 50 different efforts and programs and interventions, and it's so hard to know who all is working on what. And I think Ann Deacon probably has the biggest Rolodex of that and would be an amazing presenter on who all is doing what. But I do know that the school districts play a key role for youth mental health in particular, and they also struggle to afford mental health counselors. And then we have different nonprofit programs, as I know you know, that have specific interventions and are so important. And then the Whatcom Family Community Network, working in partnership with Ann Deacon's team and the health department. There are a number of coalitions and you know, targeted interventions that are trying to get to children, especially because we're seeing in the data that anxiety is on the rise, depression's on the rise, suicide ideation is on the rise. And so people are working on these issues. On the adult side though, and the downstream, the thing that comes to mind is all the different listening tours that we've conducted as a community. When Councilmember Barry Buchanan led the jail listening tour after the last jail vote failed, we heard over and over and over again that community members need access to treatment and they're not receiving that access. And then again, with the listening tours that Mayor Fleetwood and Executive Sadhu just hosted, we hear that theme come up again. It's a serious issue in this community, and that's not a surprise to anyone. And so that might not answer your question, Mike, about like a shining star or what the solution is, but it's just a lot of different programs needing to work together and to be reinforced and mapped so that we know what's happening. Anne, are you listening? I'd love for you to help and add anything.
I'm listening, and obviously we could talk forever about what we do have, and we could talk forever about what we don't have. So, with the local behavioral health sales tax, we put out over $1 million a year in programs to youth. And we chose to put a lot of those dollars out through the school districts because that was our only avenue to get it out into the different geographic regions of our county. And we do a number of programs that involve the school communities, so we are able to reach kids that are younger than school age, and I guess that's the good news. And then of course we have 4 different coalitions focused in 4 different geographic areas based on not only need but also the capacity to put together some grassroots programming, and all of it is prevention oriented. So very similar to what you're talking about, Heather, trying to get to the bottom, as close as possible to the bottom of the pyramid. Obviously, we do provide some counseling. I do think what we have heard is a couple things. One, there aren't enough mental health clinicians in our area to serve the need. There's just more demand than there is supply. And secondly, we hear from our care crisis line that the calls coming in have increased acuity in terms of anxiety and depression, and that they are on the phone longer than they used to be with people calling in. And they have a text line for youth that is really highly used, but definitely the same trends: increased anxiety, increased depression, and in a more acute way. So it requires more time to respond.
Thank you both for that. And I guess I just have one more question, and maybe I'll phrase this to both of you. And please, members, if you have something, either wave at me or I'll try to look at the participants list and get you answered. But what can we get behind, I think? And so, as our subcommittee, we're not really creating the program, but we want to be a capacity builder or a booster or a mouthpiece. So I guess, how can we be helpful? It sounds like some great work, multiple coalitions, really advancing the whole concept of youth and young family wellness. Obviously, that's going to help us in our PETA to prevent issues. And so I think it's very clear. But I guess, is there something today or something that we should be entertaining as a subcommittee about a way that we can be more supportive in this work? If there is, I'd be really interested in hearing what that might be.
I think what would be really helpful is education to the community and to the policymakers. I think people are not aware of the impact on the criminal justice system when these issues are left unaddressed early on. And there's a lot of data out there, a lot of research that connects that. Poor school performance is a classic example. People lose hope. People feel like they can't accomplish things. They might begin to drop out, and so on and so forth, down a slippery slope. So we just know that there is a lot of research out there that isn't widely understood. And I think that's one thing this committee could do. It's not like we're going to drum up more money and create more programs right away, especially in this economy, or even have the impact to address some of the significant factors that come from the federal level on down. I mean, we certainly know we have limits, but one thing that we don't do is educate our public about, the causal factors for why we even have an incarceration prevention and reduction task force.
I would add a couple things too, if I may.
Yes.
And I totally agree with you, and could just listen to you talk about this for a long time. I just think, I think you're right on, and it makes me think about so Whatcom County passed an ordinance or a resolution to address juvenile detention, and that is an avenue that I think would be really interesting for this committee to explore the root causes of what is causing juveniles to end up in detention. And my prediction would be some of that, at least, is driven by behavioral health issues being presenting in schools and maybe not being addressed adequately or fully. And so that could be I think, a meaningful place for this committee to go and get behind. Why not have the lofty goal of not having any kiddos in our jails? And we've gotten pretty close over the last few years, so I don't think it's impossible to do that. And there's lots of value statements behind that as a community if we could get behind that. And then secondarily, going way upstream as we develop the children's initiative work and advance that, I think the committee would be invited to endorse that and participate in other ways. And I'll just that would be something to get behind. That would be like a home fund kind of opportunity where we could bring all sorts of people together and advance a vision for children and families that includes behavioral health supports.
Byron?
Thanks, Heather, for your leadership on this and bringing this forward. As I'm thinking in terms of like how does this relate to crime and children? One of the things that just comes to mind as a brainstorm idea is that in terms of educating our community is their responsibility as mandatory reporters. This is a place where you can identify kids at the very beginning, you know, early on in situations, and also identify crimes that are happening as well. I think that might be a really opportune place to look at what is our community responsibilities related to this. And when we start talking about our community responsibility to protect children, I think there's a lot of leverage that can be made in that area. And that's not just young children, that's also, you know, kids in school. You know, I think down in Bremerton right now, there's a whole group of a student body who's outraged by the fact that, you know, they're being abused by peers in their school, or they have concerns and their school's not listening to them. So these are, I think this kind of thing could actually, you know, kind of go, you know, on all ages, but also talk about our community role and address crime and address the situations where crime actually does impact the mental health and well-being in the future of kids, and whether or not you know, they find themselves in the criminal justice system. If you look at the prisons, you know, what 80–90% of people in prison have been in foster care. So I mean, I don't know, you need to go very much further than, you know, what are some of the root causes of why people are in jail? Well, there's issues of child abuse and neglect are right up there at the top.
Heather, I have a question. Mike Hilly. Is there a relationship between the CHIP program and this? So, you know, the Children's Health Insurance Program, I would assume would have a component that pays for behavioral health, mental health services. And I'm wondering if there's some connection with this project that can make sure people get that healthcare, you know, behavioral healthcare through that program where it's funded.
I think that's a great question. I bet Anne knows more details about that. I will say generally that even when children and families have insurance, we don't always have enough providers that will accept that specific kind of insurance. But Anne, you probably know the ins and outs of that.
Medicaid expansion has made a big difference, and so it has certainly broadened the number of clinicians that will take Medicaid. But I think it's still the same issue, Mike, is not only not enough clinicians that work with kids, because it does take, you know, additional specialized training to do so, but also transportation has become a real issue. And you already know that one as well in other talks we've had. So I just think this is a difficult time. I think it's also difficult for kids to use the virtual meetings. I've talked to some college kids, for instance, who have told me that they just got tired of repeating themselves, that the therapist's internet kept going in and out. They didn't hear them. I mean, you know, all those things you don't think about, and then they give up because kids, you know, want what they want now. And that's just the nature of their brain. It's not anything, it's not a character flaw, it's just who they are. And, you know, if it doesn't work for them, they're not going to use it. So I just think we have a number of different issues going on right now over and above what we typically see, which is just not enough clinicians who have the expertise to work with children.
Yeah, right.
And especially family therapy, which is even more intense.
You know, I think about Northwest Youth Services and the kids that are over there, you know, does somebody help them navigate to get that payment? So, for example, if they are homeless, you know, Dean White group may try to navigate to get payment to be that, you know, surrogate or proctor, if you will, to get those services to a patient like that. I don't know if there's a need for some type of navigation for that, but I just, you know, if there's a way to pay for it, at least for the homeless kids, you know, and get some of that paid for, would be
Right. We do. They are, we did work with them, and Perry's on the phone. He helped get some federal block grant dollars to Northwest Youth Services to provide mental health services to their clientele. Again, you need specialized people who can work with kids who have been disenfranchised for a while.
Stephen Gockley has his hand raised.
Stephen?
As a board member, I feel obliged to add to the list of resources the Dispute Resolution Center, which has made a pretty good transition to remote mediation of parent-child disputes and as well as child custody and visitation issues, all of which are not right down at the roots of some of the things we're talking about, but certainly could create an environment where some of the other interventions can take hold in a more productive way as well.
That's an excellent point. I wonder if you all are comfortable. This is kind of our main subject of today, so continuing it briefly because the conversation is good. I'd like to keep going, and I guess with that, that's also because I have a question. So I'm curious with some of the experts in the room. You know, one of the things in homelessness with housing case management services that we see is the experience of being inside the home, and it's very different, and there are certain folks we wouldn't be able to reach if it was a traditional model that maybe those of us on this call do, where I make an appointment, I go, or I teletherapy. Yes, Clara, you have a point. But do people see a real value in that? Because I think, you know, I hear transportation is an issue. I participated in that Healthy Welcome, and when we looked regionally too, there's big differences in terms of where is underserved and where is better served. So sometimes the transportation is a big issue. And another reason I bring that up, and you brought up a great point, you know, my sister's a therapist in town, and working with really, really younger kids telephonically doesn't work very well. But she's finding with high school kids, if it wasn't their first rodeo with a therapist, they're taking to it relatively easily. So even within youth, there's not a unified response to COVID. Some can get the care they need and be okay, but others just really cannot. And I'm wondering too, is some of that because really what they really need is in-home delivered services. And either of you that have something on that for me would be great.
You know, there is a program called Home Builders that does in-home work. You know, I just think, I mean, I started my career doing therapy with kids for, you know, well over a decade. And in-home work was the most effective because you could be in their environment, you could see what's going on, you could set up systems and change behaviors because you were right there with them. But I just think, again, part of it is money and part of it is expertise and comfort on the part of the clinicians. So they're not going to get paid anymore for being in the home. They will if it's a Medicaid family, but not if it's a private pay family. And you'll also find that clinicians just aren't as comfortable doing that work. It takes special people. And I think I just see this throughout everything we try to put together in our community is trying to match the right people with the right program and the right services is very important. And we're talking about kids who are very vulnerable, can be very young. It takes, you know, a certain type of expertise to work with those kids. And it's rewarding work. I used to work with 3- and 4-year-olds and their families. I loved it, but there weren't very many people who loved that. You know, I was one of a few. And I just think that's, if there was anything else, I guess if there was a way we could help promote the expansion of clinical staff and just professionals who could, you know, if there was, I don't know, an extra subsidy or a stipend for doing this kind of work or something, I don't know, but if there was a way we could expand the number of clinicians who have this skill level, that would be wonderful.
Real quick, I'll just chip in from the more of the emergent services. And again, I think everybody agrees there is while there's an overall lack of mental health services here locally, specifically with the youth, what we fall into, and back in the day, a lot of these kids did end up in juvenile detention because there was usually a crime associated, but there weren't any other options. And while we don't take as many kids to juvenile detention, there's really nobody, not a lot of resources still. And I know one of our mental health deputies is in the process of finishing his schooling. So when he moves on from this career, that's his focus is going to be on youth behavioral health. And just because he sees from both sides of it, just there's a huge gap there. And I would advocate as these teams develop, and I know Dan's been pushing this on the city side, but MCOT obviously is a resource we can call, but it'd be nice to add some kind of youth specialist to that team as well, so that again, a lot of this is follow up 24, 48, 72 hours down the road. When we come across these kids, they're in the midst of mental health crisis and they need assistance now. So
Oh, go ahead. Sorry.
No, please go ahead. That is a great suggestion, by the way. I think I was looking for something that we can sink our teeth into and maybe get behind. And Doug, the rubber's hitting the road a bit. Thank you for your comment. And Heather, please.
Mike had something too. I want to yield.
Yeah, no, Doug just kind of reminded me of something that's just going on in the rhetoric right now. And I'm noticing a lot of cities are pulling their officers out of the school systems, which is a shame, because I think that first off, the school, even for a homeless person, is the only family connection they got. It's the only education information they're getting. And if you identify a homeless person in a school, those officers, I think, have been great resources for that. I don't know, I haven't heard that that's happening here in Bellingham or the county, but yeah, absolutely. I think that's the hole in the safety net right there, without having any option at a school to know that a child is homeless and seeking service and even mental health issues, which causes them to act out or have behaviors in those environments. It's hard to understand. So I think it would be probably good to prepare for that gap if there pops up here as an issue.
no, I agree with Mike. And absent a school resource officer, I mean, our deputies and officers are interacting with the school districts on a daily basis. I mean, those counselors are really the first line to identify those early warning signs. And I got involved years ago when it was kind of active shooter response was on the forefront, but we've kind of evolved towards, they've developed teams that have, mental health providers, the counselors, the school staff, as well as law enforcement, trying to, look for those early warning signs that, we can provide some help before it escalates to further violence, especially within the school system.
Yeah, thank you for that. That's really good. And Byron, it made me think a little bit about your staff and some of the work that you do. And you brought up the point about being mandated reporters. Anything from Bridget Collins' standpoint in terms of if we do, going along with Doug's recommendation that maybe MCOT needs some specialized youth focus, either officers or training or response. Anything from Bridget Collins' work that would guide that thinking?
Not that I can see. That seems a little off from where our focus is. I think, what do you do with the kids afterwards? Where do they go? Schools are not really equipped to handle, even if you put one officer in there, they're triaging, but you still have the problem of not having enough mental health counselors out there that are willing to do this work. So I really like the idea of somehow helping to build that workforce within our community. And I don't think it's necessarily only has to do with, trying to, create stipends and add more money to draw more people in. It may be, or a strategy that we try to employ is looking at people who are wanting to get into this field and need to get good experience and need to get good training and need to get good supervision, you know, as they're going through and gain that experience. So I think building that workforce somehow by creating, you know, opportunities for people to, you know, start working with those kids under really, really strong supervision will really expand the number of people that might be interested in doing this work, because it is very true. And I think the younger the kids get, the fewer mental health providers they want to work with the kids, because of the trauma is so challenging, and working with them is so difficult.
You know, Mike, I went through the HEROES Act is, I think, just got passed through Senate. It's an interesting read if you have time to go through it, but there's a whole section in there about workforce development, specifically towards behavioral health, mental health for systems. There was a lot in there to digest, but it looked like there was significant funding for workforce development around these areas coming out of the HEROES Act. It hasn't passed yet, but it looks like it's staged and ready to go. I'd be glad to send my link to it, but if you just Google the HEROES Act, the legislation will pop right out. And the last session or the last look was back in June. I think it said the Senate had passed it through back in June and needs to go over the House. But there was a lot of workforce development language in that section.
Yeah, thanks for that. I understood it the other way around, that the House passed a giant HEROES bill around that time frame. It was waiting for Senate to take it up. They didn't. Then the House has sent a second and smaller package by I think a third to a quarter less. But I hadn't heard that it passed. So you heard that it passed today.
Yeah, no, it didn't pass. So, no, you're correct, Mike. It had gone through House and probably waiting for Senate.
Probably waiting for Senate. Yeah. Well, you know, when I heard Byron and his comment about workforce development, you know, it made me think about, you know, substance use disorder specialists. This particular committee dealt with that, and Ann and Perry, I know your staff were really instrumental in Whatcom Community College now has a substance use disorder professional training program. And as I heard Byron talk, there are probably more ways to address this issue than just creating a training program here locally. Maybe that's not appropriate, but maybe facilitating their ongoing clinical licensure requirements or something like that I was hearing from Byron could be really helpful, because it's not just right that they don't have access. They don't have access because there may not be a person trained to see them. And while it's not the work of this committee to devise an educational program, we certainly can get behind and push levers and make recommendations for folks that can. And Heather, I think you had your hand up.
I just wanted to offer a few things too. Mike and Doug, what you're talking about with the school resource officers, I'm thinking about where our community is right now in these conversations, and wondering about that, kind of flipping that idea on its head. And what if it wasn't a police officer that was there, but another professional that could offer those supports and make those connections in the same way? And just that the value shifting around, are we asking our law enforcement and our criminal justice system to be the safety net when it's really not designed to be the safety net? And so I think that, I mean, that could be a very rich discussion, I'm sure, especially at a committee like this. I do want to share a couple of things too that have just been on my heart and mind as I'm listening to everybody. Prosecutor Ritchie hosted a convening on juvenile justice. I think a couple of you were there, or your staff were there. And somebody said, kids will only ever be as successful as their parents. And that's, you know, we could argue that, but the point was that if a kid is given the mandate that you need to do your homework before 5 p.m., a parent needs to be home, or somebody needs to be home to help support that kid to do that. And so, you know, another program that Bridget Collins has is the Parent Academy. And I think it's not just focusing on the youth, but it's the ecosystem around that child, and that means family. And when we look at adverse childhood events, having an incarcerated parent is a significant adverse childhood event, which has been proven in the research to have adverse outcomes on health later on in life. And so that's another direct intersection with the criminal justice system that To focus on prevention, you have to even go downstream and look at reentry and make sure that those parents are supported, because they have children too, and we'll see cycles happen if we don't do that well. And then I love this conversation's going all over the place, from policies to funding to workforce. And Joe Fuller has said something that I really love, where he says, there is no silver bullet, but there is silver buckshot. And I think that the point is that there's a spectrum of solutions that we all need to be employing together. And sometimes a gap for me is what is really truly understanding what is the need. Like, I wish there was the magic formula of, if we just had 40 more mental health counselors, then no kid would be turned away. No kid would go sit in the hallway at Peace Health and then be escorted out 12 hours later with no help. And I just want to finish with one story that I heard from a physician who is on my board. Anne, I think you were here for this story. She had just come from the hospital. She's a hospitalist, and she had been treating a young man who I think had lost his feet. He was homeless. He had been in and out of the hospital, and his feet were amputated because he was a chronic drug user. And when she started to get to know this young man, he said that his mom was a drug addict, and to make him be quiet when he was a baby, she would shoot him up with heroin. And what trajectory does that put a young person's life on? And how can our systems intervene so that we change that trajectory? Because we failed that child and we failed that mom. And so this happens, it's real, and it's in our community. And I know you all know that because you all see and work. And that's why we are at a committee like this, because we don't want that to ever happen. So I hope we can do more as a committee in this area.
Well, thank you for the thoughtful presentation that has started a really good discussion. And I think more to come. We do have a few more items to finish up, but I just want to thank you for your time and interest. And I think it helps us, as Dan probably phrased here, right? This committee has really been focusing on the early part of prevention and youth. And it's really helpful to get more education around that and hearing more about it. And obviously having Byron on the committee is invaluable, but it's great to hear the other perspectives as well. So thank you again. I think you're going to be up next. So if there weren't any other questions, I'll go ahead and move us on to the next item in our agenda, which is actually talking about representation. And I think you and Megan Ballou were going to lead us in a little discussion about that. Is that right?
I actually would love to postpone that. Megan and I haven't had a chance to connect, and she's not here today either. So if we could move that to another meeting, that would be awesome.
We're happy to do.
Thank you.
Sorry, my daughter is having some opinions here. Okay, so we'll go ahead and table that. I'm sorry, go ahead, please.
I said it's music to our ears.
Okay. She's a sweetheart, but she's not getting exactly what she wants, which is 100% of me. Next up on our agenda then, and Heather, is that okay if we reach out to you and possibly our next meeting for that?
Yeah. Yes.
Okay, super. So next up then is a brief update from Dan Hamill on our communication planning efforts. Dan, if you're ready.
Yeah, sure. Thanks. That was a really good discussion. I'm glad that we took the time to do that. So I just wanted to follow up with you all on some comm items here for the benefit of the group. I'm going to make a proposal here to the group. I'd like to do what Mike Hilly had mentioned about either once or twice a year, we do some kind of forum, or, it's probably going to be on Zoom, I would imagine, for the, if we start this the first quarter of next year, have a forum, have a presentation, have the public comment period, have an opportunity to respond or dialogue with citizens. And I think, Mike Hildy, I think you also advocated for putting out like a kind of an update a couple times a year. I think that, we can and should do this. I think there's a lot of movement, especially within behavioral health conversations right now, where I think the timing is right for this So what I'm proposing is a couple times a year we publish an op-ed piece. I picked up a copy of the Cascadia Weekly at the store the other day, and there's just not a lot there. I don't know if they're not doing the op-ed pieces, so I think that's got to, we've got to factor that in. But if we can talk to Tim Johnson and maybe get some, a little bit of ink, 400 or 500 words a couple times a year, that would be helpful. And then take that same information, post it on Facebook at the county and city council Facebook pages, the city of Bellingham and Whatcom County pages, wherever it makes sense in social media to post that. And I'd like to work with the Bellingham Herald. I think that the daily paper of record is often overlooked when it comes to reaching a lot of folks. A lot of people still, that is their news source. So I'd propose working with Denver Pratt and Robert Mittendorf, they're two reporters over at the Herald, on coming up with some format for an article, whether it's an FAQ or a news article. That couple other just quick other items. These meetings are now posted on YouTube, which is great. I don't know that we drive traffic to these meetings. I don't. I'm wondering if there's a way that we could possibly work with our comms person at the county that Executive Sadhu was kind enough to loan to us for ideas and maybe some strategies. And then Stephen Gockley had brought up notations for agenda items within the posting, so that way a person doesn't have to sit there and try to figure out where that one item that they really want to get the information about, where that's located within that longer video. So those are my proposals. I don't know that we need to make a motion or if you guys want to talk about it, but that's kind of what I came up with, and I'd love to hear feedback from y'all.
So if anybody wants, they could just speak. We're a small enough group. You don't have to wait for us to call on you with your hand up. Dan, really quick, it was an excellent summary, I think, of what we talked about in steering. I really wanted this group to be able to hear that offer of assistance, because that's been a challenge is for this committee, but all the subcommittees and the main task force about communication. So I guess realizing that we have an upcoming resource for behavioral health subcommittee and what kind of things would we want to see in it? These are really useful things, and I'm really glad that you brought that up.
It's a great idea. I'd love to help out with that. And that intersects with really, our GRACE programs and potential co-responder programs down the road in response to these things that we talk about in the meeting. So I'd be glad to help with that and do that work. Yeah.
Okay. I would definitely take you up on that, Mike Hilly, for sure.
Another thing too, Dan, and I think we talked about this in steering, but if we didn't, or remind me, but Jill worked with all of us to create kind of an annual report, right? So we could take, that is quite a lift, thank you, Jill, but we could take some of that data and some of those report outs, and maybe that could be the meat of some of the graphics for semi-annual updates or something of that, because it's supposed to be kind of chronicling our work.
Yeah, I totally agree. I think let's pull from the main report in whatever way makes sense to get it out to folks. So I'd just say, Mike Hilly, if you want to work with me on that, we could take the lead, just like Heather and Megan are working on the, engaging, better, more representation. Mike Parker's working on the racial equity tool. Everyone's got their pieces, right? So Mike, Hilly, if you want to do that with me, I'd say maybe we can get started. I'd say maybe aim for the beginning of next year. That gives us enough time. We've got a bunch of things coming online theoretically. But I think that would give us a little bit of breathing room to create a good forum presentation, op-ed, whatever the pieces are. I think that'd give us enough time.
Yeah, no, I would be glad to do that, Dan. And I do have a bit of data from the EMS system as well in regards to behavioral health calls, along with the community paramedics and their response to mental health out there as well. So EMS will be able to provide some data. And I'm sure there's a bit of data from the sheriff's BPD as well on types of calls that they go out to. And we can probably build a little story of the trends that are going out there, especially pre and post COVID, that we've got some data that shows some difference in pre and post COVID mental health issues, so including suicide.
Okay.
We'd be happy to kind of give a summary of our mental health deputy program. I'm sure Bill and Hammond do the same.
That'd be great. Thank you.
You
Appreciate it.
bet. I'll keep the calendar open in January.
Okay. Well, let's maybe offline we can schedule a time or two in between now and then where we can maybe just strategize a little bit on how to do this the best way.
Absolutely, yes.
Okay. Thank you.
Okay, any more on communication pieces? All right, so our next up was just kind of a discussion really for all of us, but we have a upcoming November 10th joint meeting with the Legal and Justice System. So for those that may be new to our group, we did this, I believe, twice last year, all kind of pre-COVID, because there were so many items that were kind of jointly being talked about in both of these subgroups. We did decide to do, I believe, twice annually. I don't think we've done one since COVID, if I'm not mistaken. So, but this item on our agenda is just what items particularly would we want, at least from our subcommittee, to make sure get talked about at our joint meeting. And I'll just open it up a round table. Jill, do we have some way to capture, I guess we're recording. Will that be sufficient enough to capture for us?
Yes, that's good.
Okay. So yeah, if anybody wants to popcorn style, what items?
I'll go and I'll just go first. So one thing we talked about this a little bit at the last, maybe it was meeting before last, but I'd like to know from that committee what their position is on SOCs for low-level charges, so stipulated orders of continuance, how that's working out. DWLS third, how that's standalone charges, how that's working out. VOXA, violation of Uniform Controlled Substance Act, taking those to misdemeanor versus felony, what that's looking like. We had a report out yesterday from City Council from Chief Dahl that our crime trends they've been dropping according to WASPIC, the Washington Sheriffs and Police Chiefs Association, that there's a 12% year over year times two, or last 2 years, 12% each time dropped. And we know jail admissions are down. I think they were 15% prior to COVID. I don't know what they are now. I'd want to have some data around that. I want to understand how those 4 components are working or not working. And then also I'd want to get a drug court housing and program update. And I don't know where that lives. I mean, it could live within our committee, but it doesn't. So or maybe it doesn't. I just don't know it. But I'd want to hear from Legal and Justice to if they have any updates on that. I just on those first several items, I don't want people to draw more charges. You know, if there's just, and I'm not saying incarceration is like the way to stop a person from criminogenic behavior, but if people are drawing more charges, then they're not being served properly, in my opinion. So yeah, I just have concerns around those items. So those are my 5 things.
That's great. Anyone else for items for that joint meeting on November 10th? I think I too was really interested in drug court and mental health court both. Obviously, Opportunity Council, as folks know, is in the process of developing, although it's going slower, much slower than we want, a treatment program that really is designed for folks from drug court, and kind of that divert to where do people go? And there was a lack of resources. So with our partner Lifeline Connections, we're working on that. But I'm interested in that system and where they see gaps too, because I think that is a role of our task force, is to highlight those gaps and then make people aware of what those gaps are and what the solution could be. So I too would be really interested in hearing, and I don't know, Ann or Perry, from your perspective, are those fairly easy to get, like a mini kind of stat update from our various therapeutic courts? Ann, Deacon, or Perry?
Easy.
Easy?
Yeah.
Ann and I had an opportunity, and I imagine Ann will probably talk a little bit more. We were actually talking a little bit about drug court and the possibility of including DUIs in drug court, which for a number of reasons, I actually was able to touch base very briefly with Chris Furman, the drug court program manager, about this. And at this point in time, really just sort of the legal process is drug court is set up for felony charges, and oftentimes DWIs don't reach that. But obviously, a pretty significant legal involvement, typically projective of pretty serious substance issues. Oftentimes, certainly if there's more than one driving offense, it's actually a criteria for DSM for substance use disorder. And so I can certainly gather some more information, but I know that Chris Furman historically has been pretty involved with the Justice and Legal Committee, and so certainly can get some really good information there. And maybe some possibilities of expanding some existing programs is really where Ann was coming from in the discussion today, in terms of kind of being able to provide services to individuals that are involved in the judicial system at this point, as opposed to maybe creating new programs, expanding programs that are in there, that currently exist.
Awesome. Thanks for that, Perry. That's a really good point. I think we're hearing that a little bit with like Cahoots, right? Do we have something that it operates somewhat similarly and we can add to it? That's a really good point. Stephen, I saw you had your hand up, and then maybe Byron.
Yeah, I do, Mike. Thank you. I've been having some recent conversations with Chris Furman and Shoshana Page, the public defender handling drug court. They've had some challenges, as we know, when the courts shut down and then reopened, but remotely with managing the drug court caseload. Also, partly for a reluctance to file charges and some other prosecutor practices, there's been a decline in drug court participation over the last 6 or 8 months. They're trying to sort through that stuff. I'm trying to talk with them, and that goes back to the fact that in response to Dan's question, drug court has resided in the Legal and Justice Systems Committee historically. I don't know that they're going to be ready for a November 10th meeting to really plow into where this committee wants to look at drug court issues, but I think that's a three-way relationship between Chris and Legal and Justice Systems and Behavioral Health that we want to maintain and keep active, because there'll be some troubleshooting and problem solving, and as with often is the case with drug courts, some slightly disputatious conversations to be had around everybody getting on the same page with the goals of that program. But I think that's really a valuable place for this committee and the other committee to devote some attention over the next few months.
And thank you for that, Steve. And Byron, did I see your hand up, or did I? Oh, okay. I probably just saw something different. Anything else on agenda topics for our November 10th meeting?
Yeah, a couple more things. I'd love to know how the LEAD program is going to work in terms of courts. It'd be nice to get an update from prosecutor's office, and then also Crisis Stabilization Center. There's been talk about involuntary commit on the mental health side. I'd like to just have a little bit more in-depth conversation about those two items in addition to the other ones I brought up.
And Mike Hilly, I thought I saw you motioning there.
Yeah, thanks, Mike. I just, because I'm not in the main loop on the lead conversations right now, I do know from Melara's desk at the GRACE program, there's still a lot of ambiguity how this integration is going to work with the GRACE teams. And yeah, it is around, is there court involvement? Is there an expectation to send people to the crisis center for some type of outreach at that point? How's this whole thing going to mix? Because we know that those, and they've hired a couple now already, caseworkers to work for LEAD, and how that's going to integrate. So it'd be nice to get an overview of what that vision is, because I'm not sure and making a little bit closer to it. I'm not sure we're clear on our side exactly how that's going to integrate with the GRACE program, you know, a whole, because right now it's a EMS centric, fire centric kind of thing going on, and open arms to it, definitely open arms to it, but we just need to understand it, I think, a little better.
And I was going to mention when they were talking about mental health and drug court, I mean, really think of the LEAD program as, you know, mental health and drug court is kind of after arrest. This is dealing with folks pre-arrest.
Yeah.
So it's essentially deferred. So reports are written, but as long as there's some follow through on the part of the involved person there, they likely won't see charges filed down the road is how it's supposed to work. So we'll, again, we're just kind of getting off the ground with that. And I haven't been plugged into the LEAD, but we've got certainly people here from the sheriff's office that have been involved in the policy group and everything else along the way. So that is up and rolling. But like Mike said, it falls under the umbrella of GRACE. So how is that going to differentiate as far as some of the people that are enrolled in that program?
So we can certainly talk about that and how both those programs, especially LEAD, will be working with the Crisis Stabilization Center. So the Crisis Stabilization Center has had these discussions, Dan, that you were just talking about. I don't know if you want to include that committee with the other joint committee session or how you want to do all that.
And is that something that you could just provide some navigation through, you know, in terms of the messaging from the Crisis Stabilization Committee?
Certainly.
Might just be easier that way. Okay.
This is Heather.
Yeah.
Two things on my heart and mind that may be way too far out there, but I just feel like I should bring up. One is we learned at one of the legal system subcommittee meetings about some of the race disparities we see in our jail locally. And I hear people say, for example, our Native American population is about 3% of Whatcom County, but it's about 16% of our jail. So there's a big gap there. And I hear people say anecdotally, well, it matters about who is arresting, and that's being driven by Lummi Nation arresting Lummi people. And I'm not sure where that comes from, and if there's a way that we can get to that second layer of data to understand that. I think that that's a really relevant conversation in the community right now. It may not be this committee's role, but it did come up at the committee, and I think is important. And the second thing that's on my mind as it relates to incarceration and our jail is there was an article in the Herald a couple months ago. There was a lawsuit filed because an individual committed suicide in our jail, and he was a daily heroin user and was not given the proper treatment, is what the Herald article was saying. And I know there's rules about what we can and can't talk about. But I do think that that relates to the conversation we were having earlier about support in the community and not having other places to bring people. And I have wondered about what happens after something like that happens. Is there a post-mortem? Like, for example, in healthcare and hospitals, if there's a wrong, somebody who dies on accident or wrong site surgery, the team comes together to do a post-mortem to say what went wrong, how can we change the system so that this doesn't happen again, and takes that personal blame out of it. It's not about, who did something wrong, it's about how can we make a better system so that this doesn't happen. But I just don't know what happens after things like that happen. And I think at the very least, we should have a goal that no one dies in our jail if they're gonna be in our care there. So those two items, wherever they belong, if not at the committee, that's okay. But I'm being braver in sharing what I think these days. So
Heather, just to clarify your first point on the Native American population in the jail, are you looking more for information about not generally the makeup of the population in the jail, but what agencies are making arrests? Is that the information you're looking for?
I think so. I think it.
Okay.
And I also don't know what I don't know. So I'd look to other people that that help us understand what's driving those disparities. And can we get to at least the second layer of bookings? What agencies are booking what racial makeup of people?
Okay. And then just real quickly to answer your second question, there is a kind of an after action review anytime there's a death in the facility.
Stephen Gockley has his hand raised.
Stephen?
Thank you. Just to reinforce part of Heather's first point, those of you who were at the whole task force meeting yesterday know that we are probably on track very soon to adopt the racial equity toolkit from GARE that Mike has so kindly introduced us all to. And one of the things I've been thinking about that is the central role that data plays in the kind of pre-decisional analysis anybody would do in making recommendations for government action. I'm putting that together with the second layer of data that Heather was encouraging, and the fact that the index committee is just now getting some new leadership and asked the whole task force for direction on where to focus its work going forward. So I'd like to suggest, back to Dan's original point, I think, in terms of topics to talk about at that joint meeting in November, is to identify, I mean, we know more about what our data needs are and what our data gaps are now than we did when we fed in questions to the index when it was organizing. So maybe it's time for us together as two committees to revisit the question of what data would we like to get that we don't have. And so I think Heather's point about that secondary data of who's doing the arresting would be very appropriate for our discussion at the joint meeting. It would be very appropriate for starting a way to think through implementing the racial equity toolkit. And so I think it would serve a number of purposes if we talked about that next month also.
That is an excellent point. Heather, when you brought up that stat, we looked at housing data, and we found, obviously, we looked at the same American survey from the census, the 3%, and 12% were experiencing homelessness from point in time count. And just disaggregating that made us look into, well, how about our housing programs? How are we doing? We actually found referral rates higher than the population would warrant. We found, though, how long people kept housing was shorter. And so I think that the only reason I bring this up is there's a point to disaggregating the data. And the point is then we know more, and then we can make much smarter recommendations to those people doing the work. And if we don't ask those tough questions, if we don't disaggregate that data, that is lost to us, that need. We haven't fixed it, by the way, but knowledge is a long way to going to it. Is there anything more on that? I know I'm over time, so I feel like a bad meeting host. So my apologies. I am keeping us beyond the meeting time. If there's nothing else for agenda topics, accept my apologies, and I think we'd be ready, unless there's other business, to go to public comment if there is any. Is there any other business, any other items? Jill, do we have anybody? I know we've got a couple of participants. Do we have anybody for public comment?
If any of the attendees would like to speak, please raise your hand and I will give you speaking privileges. And I don't see any hands raised.
All right. Well, I want to thank them for their attendance and for listening in. Thank everybody here. And Stephen, thank you for the plug on the Racial Equity Toolkit. I think I'm going to go to that group. So hopefully it's not during our joint meetings. You guys will have to see me again. Anyways, I want to thank you all for your time, being flexible on rescheduling. And if there's no further business, then we will go ahead and adjourn this meeting of the Behavioral Health Subcommittee. And thank you all.